begins with a gurgle in your stomach. You start feeling pretty unwell, likely running a fever, and pretty soon you're running to the toilet too. And this continues for the next 4 days, giving you more than enough time to lament that dodgy servo pie you had for lunch the other day. It's food poisoning. We've all been there. Indeed, 1 in 4 of us will experience it this year. That's more than 8 million cases in Australia each year, which is a lot of time off work, a lot of time and money spent at the doctor, and a lot of time you just can't spend doing normal things, like being with your family. When you tally it up, it's 22,000 years we collectively lose each year, and more than $1.3 billion spent. But while you're lamenting that dodgy pie, spare a moment to lament climate change too. It might sound like a non-association, but a lot of the pathogens which cause food poisoning are bacteria, and bacteria grow really well when it's hot. So as our temperatures are rising, more often our bright sunny days are the perfect conditions for growing bacteria. More bacteria then infect our chicken flocks or grow on that meat that you left on the counter for a little bit too long, causing higher rates of food poisoning and incurring higher costs. But what will those costs be in future as our climate changes? Right now we don't know. We're not really sure what warmer temperatures or less rainfall in Queensland will mean for food poisoning, and so nobody's done the math to figure out what the costs will be to our health and to our wallets. So I'm doing the math. My research is measuring the influence of rainfall and temperature on food poisoning incidents and calculating how many healthy days we'll lose and how much money we'll spend treating food poisoning in future as Queensland gets hotter and drier. Because healthy days are what matters to us, if we feel well enough to take the kids to the park or to meet up with friends. But money is what talks to governments. If we want preventive action taken, we need to be able to tell our governments, hey, if we don't do something about this now, it's going to cost us X billion dollars really soon. And we're looking at this regionally too. So we can pinpoint the places in Queensland where the climate will encourage bacterial growth, like a lukewarm rotisserie, and say you guys in particular need to take preventive action now. And when I say preventive action, I don't necessarily mean stopping climate change, though that should be our main goal. There are smaller things we can do in the meantime, like teaching our kids good food safety practices, or showing farmers that waiting a day or two after it rains to harvest crops can substantially reduce the incidence of food poisoning. My research will provide the necessary information for our government to target our precious resources to our most at-risk regions or where we can get the most bang for buck for preventive strategies. And our methodology is really easily adapted to any country or any disease, meaning in future we could be costing heart attacks in Japan or malaria in Brazil or asthma in Chicago. Because but for now, for you, this could mean fewer queasy stomachs, less time spent at the doctor, and more time spent with family.